to our next Back to Basics training. Today's training is on goals and evaluating impact. Just a reminder to keep yourself muted. And then if you have any questions throughout the presentation, to just enter it into the chat and we'll make sure to get to those, or raise your hand. We'll be doing breakout rooms at the end, and we'll give you the directions of how those are going to work when we get to that part of our presentation. So just our BERT background of who we are. It's a reminder of the team for everyone. Myself, Paris, and Vanessa will be leading the presentation today. So this is just a reminder that MPOS for 2023 has officially opened. You should have received an email with the social media toolkit and with the images and wording that you can use when sharing the ads via your social media and website, and stuff that you can print as well for events. We will be running the survey for at least 6 weeks. So definitely please, promote it. The more you're able to collect, and push data for your jurisdiction, it helps you. It really ties in nicely to today's topic of measuring, collecting evaluation data for outcomes and just surveillance. So if you have any questions around MPOS, if you'd like to see the questionnaire, we can definitely send you the PDF of that. Most of the questions are the same. We added a few new questions from the SASE stigma index. So, but hopefully we'll get good responses. It'll be really helpful for you all.
All right, and one additional thing as well, I'm going to place it in the chat, but if you have not been a member or subscribed to the BERT listserv, please click the link and subscribe yourself for any of your new team members. That way you can continue to receive important news, updates, or anything that you may have missed.
Jackie?
Hi, can you hear me?
Mm-hmm.
Hi, I have a question for the MPOS survey. I noticed in my email, was that like, it said it had my email address on there. Was that just in my individual email notice about the survey being open, or was that telling everyone to contact me with questions?
I think it was just yours. I think it was coded incorrectly and it bounced it back to everybody's individual email. So, because we've gotten emails back for it, but I'm sure none of them went to you. So I think it was just the weird coding issue.
Just double checking on that. Thank you.
All right, so we'll turn this over to Helene.
Thank you, Nicole. Good morning, everybody, and welcome. I hope everybody is doing well. Just have a few announcements to make. So for FY24, there will be a new requirement for the local jurisdictions. We will be requiring a health disparities impact statement that will be due at the end of the first quarter of FY24. So today at this webinar, the BERT team is going to be discussing this a little bit. And so we will have a more detailed webinar during the first quarter of FY24 just to talk more about it. And also we are going to be having, you'll be receiving award letters for FY24, and those will come out probably the end of May or early June. So I just wanted to notify you of that as well. But I think that's it for the updates and any announcements that we have. Thank you.
Oh, Carol?
could I just ask Helene a question in reference to our awards?
Do you want to just type it in the chat and we can?
Oh, okay,
Yeah,
okay.
that'd be great. Thank you.
All right, today's objectives for the training will be to discuss setting SMART goals. We're going to assess ways to evaluate and why it's important to evaluate. We're going to learn how to use and display your data and findings. And we're going to introduce health disparities and how to overcome challenges.
The Back to Basics series are helping reviewing the components to build your logic model to address substance use prevention in your jurisdiction. SMART objectives are the components of an, next I'll be doing a refresher of what the SMART objectives are and the components of an evaluation. A way to develop SMART objectives is to use a SMART approach. The more specific your objectives are, the easier it will be to determine the program's success. SMART stands for the following. S is for specific. What exactly are we going to do and for whom? M is for measurable. Is it quantifiable and can we measure it? A is for attainable or achievable. Can we get it done in the proposed time frame with the resources and support that we have available? And R is for relevant. Will this have an effect on the desired goal or strategy? T is for time bound. When will this goal be accomplished? On this slide, we have an example of a logic model for an academic detailing strategy. According to the CDC, academic detailing is a one-on-one educational method where trained educators deliver evidence-based and tailored messages to encourage behavior change among clinicians to improve patient health outcomes. If you take a look at the blue box, you can see that the short-term, intermediate, and long-term outcomes are examples of how the SMART approach was used to view the logic model. Why should we evaluate impact? Evaluation is used to monitor the implementation and outcomes of a program. When you evaluate a program, you can determine if any adjustments need to be made. This process also contributes to continuous program improvement. This video is a reminder of how evaluation is used in the strategic prevention framework.
Phase, we want to measure the impact of the intervention and its outcomes. In this phase, we monitor, evaluate, sustain, and improve or replace those things that aren't working. The purpose of evaluation is to look for areas of improvement. With respect to cultural competence, it is important to make sure that the community is involved in all aspects of the evaluation process. Cultural competence. We want to consider cultural, gender, ability levels, and sexual orientation in all aspects of the SPIF. The reason why we do this is to eliminate service and participation disparities for people of diverse racial, ethnic, and linguistic populations. Each step of the SPIF requires and greatly benefits from the participation of diverse community partners. Sustainability. In this phase of the SPIF, we want to identify the outcomes that
Process evaluation documents all aspects of the implementation of a program. It monitors the outputs of the strategy, such as activities and participants, and determines whether a program's activities were implemented as planned or if any changes need to be made. Process evaluation measures dose, reach, and fidelity. The outcome evaluation documents whether the strategies made a difference, and if so, what changed. Outcome evaluation measures the changes to your selected contributing factors, intervening variables, and priorities. Outcome evaluation determines the following. To what extent did the strategy or program or practice change the individual level outcomes such as knowledge, skills, attitudes, and behaviors? And to what extent did the strategy, program, or practice change community and system change outcomes? Outcomes are changes that occur as a result of implementing a strategy. And you need to develop short-term, intermediate, and long-term objectives using the SMART approach to measure your outcomes. For each outcome, you will need to determine how they will be measured, how often they will be measured, and who the participants will be. Additionally, you should also consider the tools and resources required. And just a reminder, BERT has a guide to program evaluation that is available on our website. Next, Nicole will discuss how to collect evaluation data and how to identify different types of data collection.
Nicole, I'm sorry. Before we move forward, can we go back to the video and restart it? It didn't play from the beginning.
So it's just a snippet. It starts from, it's only a part of a video.
Okay, but part of it cut out at the end. There was someone that commented they couldn't hear it on the sound. So I wonder if we can just replay the clip really quick before you move to the next topic.
Phase, we want to measure the impact of the intervention and its outcomes. In this phase, we monitor, evaluate, sustain, and improve or replace those things that aren't working. The purpose of evaluation is to look for areas of improvement. With respect to cultural competence, it is important to make sure that the community is involved in all aspects of the evaluation process. Cultural competence. We want to consider cultural, gender, ability levels, and sexual orientation in all aspects of the SPIF. The reason why we do this is to eliminate service and participation disparities for people of diverse racial, ethnic, and linguistic populations. Each step of the SPIF requires and greatly benefits from the participation of diverse community partners. Sustainability. In this phase of the SPIF, we want to identify the outcomes that
Okay. So with Vanessa, we talked about different types of evaluation. So now let's talk about how to collect your data and plan your timeline. We have 5 tips to get you started. Tip number 1, start at the end. Start by clarifying who needs which information by when. Make sure you clarify expectations about the review process to ensure that you have the correct date. Tip 2, work backwards. Now that you know when the information is required by, you can work backwards from this deadline to plot out your data collection and analysis timelines. Estimate how long reporting will take. Block out that time. Plot out any evaluation activities which are directly tied to program activities, such as pre-surveys that need to be sent before program activities and post-surveys that need to be sent a set amount of time afterwards. Plan to analyze data soon after it is collected, whenever possible. Tip 3, leave a buffer. Wherever possible, leave your team some wiggle room, especially at the analysis and reporting phases. This gives you extra time when data collection activities inevitably get pushed because program timelines change, or when you receive really bad administrative data, which takes an extra week to analyze. Tip 4, be flexible. Change happens, especially in evaluation. Being clear on your timelines and constraints and budget means that you can be a bit more flexible when conducting your evaluation. As an evaluator, be prepared to jump on fortuitous opportunities to collect and share data. Program changes can present hidden opportunities to gather more data. Tip 5, communicate your timelines. Remind your clients, stakeholders, and teammates of relevant evaluation timelines and do so consistently. reminding others about your deadlines, and communicating when you need information by and why, such as there's a hard deadline for a report, can help ensure that you get what you need when you need it. Timelines are used to keep you on track during your evaluation process. Timelines can be created in a few different ways. Here's an example of a timeline in a chart form, having your tasks, goals, and expectations as the columns and having the timelines based on the rows. This is similar to sort of your evaluation plan that you guys submit with your whole application. Another example of timelines are line graphs to highlight key project milestones. This method of a timeline is more preferred to use when you do not have set dates, but just an order of milestones you want to follow. And a calendar, which helps you plot out exactly what you were trying to accomplish on each day, week, or month. This is an example of a NAT chart. This can be created on Excel or Word, having your stages on the left side and time frame at the top. You would then shade in each cell to correspond to when it will occur. Many of these timelines are free to download online, or you are able to create your own. When planning how to collect your evaluation measures, you need to determine your evaluation tools. There are two approaches when planning an evaluation. You can use existing materials or create your own. You should begin by researching if others have done an evaluation similar to what you are about to do, and if they've already created evaluation tools that you're able to use. So first, you want to begin by identifying existing prevention education program evaluation tools. If you are using an evidence-based program, it should probably include pre-post surveys that you would implement, as well as other outcome evaluations that have been done for that program. You also can identify existing surveys and other surveys that have been developed, potentially maybe that our team has created, or others in other jurisdictions as well. So definitely, if you have a strategy and you need a survey, reach out to us and we can see if a survey, or at least survey measures and data indicators, have already been designed. Like we say, there's no need in reinventing the wheel when we have really great tools that exist already. Can also save time in your planning. Another example are already developed tracking sheets that you would be able to modify to reflect your evaluation needs. Tracking sheets are helpful for collecting data on process measures, such as participants, people served, and sessions completed. And finally, using information provided in existing focus groups or surveys, such as demographics, to help you build upon. So some tools that you can create are document analysis, which is primarily quantitative, but can also collect qualitative data in the form of documented narratives. Surveys, which are primarily quantitative, but also can be qualitative data through open-ended or free response questions. Interviews, which are qualitative, but also can collect quantitative data by numerically coded interview responses and/or observations. Focus groups, which are primarily qualitative, but can also, once again, collect quantitative data through codes. And observations, which is qualitative and also can be coded through to make it more quantitative. And case studies. So when should you begin implementing, right, your evaluation plans? This depends on your timeline and what data you have already collected. But the most important thing is to implement. Implementation of evaluation tools such as pre and post surveys and follow-up can be used to examine how a given intervention impacts the intended behaviors, as well as the knowledge, skills, and attitude indicators that you're interested in measuring. The SASE questionnaire developed by Shatterproof is an example of a pre-post tool you can use to measure how your intervention would affect stigmatizing attitudes and behaviors, uncover associations between the intervention and shifts in stigmatizing attitudes. Evaluations can also be collected at baseline, midpoint, post, and 3 to 6 month follow-up. That's an example of a timeline. This timeline is an example, perhaps for implementing an evaluation of a campaign's impact. When looking, population analysis, such as longitudinal examples, are ideal. The benefit of a longitudinal study is that researchers are able to detect developments or changes in the characteristics of the target population at both the group and the individual level here. The key here is that the longitudinal studies extend beyond a single moment in time. As a result, they can establish sequences of events. A cross-sectional sample are good to implement. The questions you ask remain the same. Responses can be captured and compared across populations. Replicability is good for building theory, painting a holistic picture, and working towards scale validation. A convenient sample is an acceptable way of implementation. It is a non-probability sampling method where units are selected for inclusion in the sample because they are the easiest for us to access. This can be due to geographical proximity, availability at a given time, or willingness to participate in your evaluation. Other ways to implement are benchmarking, which is a standard or point of reference by which data can be compared. Change over time, which is the difference between the end and the beginning of a time period. And finally, evaluating interventions, which is assessing the impact of an intervention, typically measured at the pre, mid, and post efforts.
Thank you, Nicole. All right, so now you have all this data and we need to figure out how we're going to use it. So the first thing we need to do is analyze the data. So what is the data telling us? For example, if the data is showing that overdoses are happening in a specific area, you're going to use that data to drive your strategies. And then you're going to think, is the strategy working? You know, have your results leveled up, or do we need to think about a new approach? The next thing we want to do is disseminate our results. So who needs to see exactly what happened and who needs to see these results? These could be our stakeholders, the community, your funders, or even people within your organization. And you're going to do this by determining who it is critical to share your data with. The next thing you want to do, and this is something that I'm particularly pretty good at, is you want to visualize the data. So you want to make it digestible and easy for people to understand it and kind of look to see what's going on. So you're going to create something that shows the work that you've done. And if you create something that's visually appealing, it'll aid in the readability and the use of your data. The next thing you can think about is reports. Reports are a great way to summarize your data. Your reports are often going to have an appendix, and that's going to show the raw data and some of the information that's a little bit more in depth that people want to see. Reports also capture a very full picture of your data. At the end, the reports will also help you with assessing the progress and for you to make changes. So these are pictures on the slides of some of the reports that we have done. And then as you can see, there's some visualizations of some of the data that's collected. But we want to kind of hear from you. So in the chat, can you put, who you disseminated your evaluation results to? And then kind of in what format have you used? And you can put that information in the chat. I'm going to open the chat up so I can read some of your results. Okay, so I'll start it off to give you an example, kind of to give you an idea of what we're thinking of. So whenever we finish a survey, we're going to disseminate our results to the state because the state wants to see what we're doing and what the results of the survey were from.
That's my middle name.
Thank you, Amy. So it says we share our survey results with our opioid prevention coalition members. Great. Community coalition funders should be a big one for everyone. You can't get paid if they can't see what you're doing.
Looks like a lot
Excellent.
of coalition.
Yeah, that's good. Community support is amazing. Thank
Is
you.
most of it report of just like when you, like Jackie, when you say report, do you mean verbally report or are you presenting it in like visualize or just reporting updates?
I mean, like, we've had a report prepared, like actual report, and then the evaluator, goes through the outcomes.
It's great. Thank you. See a bunch of things: university, student affairs, president, lots of community organizations in the chat. Awesome. Thank you all for your feedback. So just before we have our breakout sessions, we want to talk briefly to introduce you to a new reporting requirement for the next fiscal year. To help each of you implement targeted interventions to more at-risk populations, you will need to develop a health disparities impact statement. This is a data-driven quality improvement approach to advance equity for all and to identify racial, ethnic, sexual, and gender minority and rural populations at the highest risk for experiencing behavioral health disparities, and also develop and implement an action plan. Healthy People 2030 prioritizes eliminating health disparities, achieving health equity, and attaining health literacy to improve the health and well-being of all. Health disparities adversely affect groups of people who have systematically experienced greater obstacles to health based on their racial or ethnic groups, religion, socioeconomical status, gender, age, mental health, cognitive, sensory, or physical disability. This also includes sexual orientation or gender identity, geographic location, and a bunch of other characteristics historically linked to discrimination or exclusion. So according to Healthy People 2020, although the term disparities is often interdependent to mean racial or ethnic disparities, many dimensions of disparities exist in the United States, particularly in health. If health outcome is seen to a greater or lesser extent between populations, there is a disparity. Jurisdictions will need to specify the populations experiencing the disparity within the context of your high need community. A population experiencing the disparity may be described using a broad demographic or cultural category. You may quantify subpopulations for more specific or as a disparate population using data in the designated comparison group. Just because you can separate out a subpopulation, such as age or age ranges, does not mean you should identify it as disparate. You should only consider a population as disparate if you identify a specific race, ethnicity, sex, or LGBTQ identity using data-driven justifications. And we wanted to highlight a one-pager that we made last year that kind of sums up everything that we just talked about. And I created this last year around Pride, but this was basically to talk about how this specific community has intersecting identities. So not only are they faced with issues such as their gender, but they're also faced with issues such as the level of care that they receive and how they are healing from the care that they're receiving. So this can be found on our website, and I'm also happy to share this with you all at the end. So it looks kind of funny, but it is infographic shape, so we had to do side by side. But this will kind of give you a picture of what you want to think about when you're starting to select your populations for that next step. All right, and I'm going to hand you back over into the hands of Nicole. Nicole, you are on mute. We'll need you to start over. Thank you.
Thank you. Sorry, I muted myself again. Yeah. So as you implement your action plan based on your health impact disparity statement, you'll want to collect data, so tying it into our data needs, to assess if you're reaching your identified populations. Like Colleen mentioned, in the fall, we'll go into, or the first quarter, we'll go into more detail on sort of what goes into the health disparity statement, as well as on reporting questions and the indicators for your health disparity statement, impact statement. But I'll quickly highlight a few of the areas. What steps did you take to ensure that high need communities are focusing on the identified disparate subpopulations? Describing any data gaps you identified related to the disparate or subpopulations, and how are you addressing these data gaps? Being able to assess if these communities are getting access to your prevention efforts. So being able to document what steps did you take to ensure that the high need communities are focusing on these identified, that's the same questions. Improving access to the prevention efforts. And what strategies are you implementing to address behavioral health disparities in your high need community? So we want to make sure that we're ensuring that prevention efforts reach the populations experiencing the behavioral health disparity. And how are we monitoring these efforts? And what are your data collection processes related to behavioral health disparity data? So just even something to think about of what data do you currently have that can identify those types of data indicators to measure health disparities. And while we're collecting our outcomes of prevention for our prevention methods, how are we also monitoring outcomes related to that disparate subpopulation at the community level? And be able to describe other ways that you can use programmatic data to demonstrate the impact of your efforts on reducing behavioral health disparities. Just a tip of making sure how many of you, when you are collecting your reach data, making sure you have that also broken down sometimes by demographics. You can see who, not just numbers, but who exactly you're reaching can help with that. So we gave an overview for sort of why we're collecting data, how to collect it, and planning, and then how to use that evaluation data. So we wanted to break into 4 breakout groups based on these 4 categories. So what we're going to do is you guys will select which of the rooms you would like to enter now. If there's too many, I will move you to a different room, but we'll give you plenty of time since at least we'll have 20 minutes at least to have discussion of these different questions. So so the first room, I'm going to rename it for you guys. So you guys, as you're reading this slide, kind of think which of the rooms you are interested in joining. And then we'll open them up.
Also, Amy and Annette, I see you in the chat. Yes, I'll make sure I get that. I'll include it as supplemental information when we send it out. Thank you. All right, so I'm going to open the rooms and feel free to join which one you'd like to learn more about and have discussion with your peers and with the BERT and OPHI teams. I'm just gonna wait a few more minutes because it looks like about a few people aren't assigned to a group yet. So we'll wait to see if they pop into this one. Mm. Okay. All right. So I guess we'll begin just so I don't waste any of your time. So this group is about how we use evaluation data. So once you've collected it, what are you doing with it? So I'll just ask a couple questions and then I'll chime in to kind of help you kind of through these questions and to kind of pick your brains a little bit. So based on your experience, what do you think is the best way to use or present your data once you've completed it? You can come off mute, turn your camera on, whatever works well for you.
Morning.
Morning.
I guess once you have the data analyzed and you are able to sort of compare it with maybe previous year's data. So, doing any kind of presentation, looking at the history and the direction of things, I think would be very helpful in presenting it to whoever your audience might be.
Thank you.
Are we talking about presenting like how we use it to complete the year-end evaluation report to state, or just like to report out to our county?
So not necessarily either one. So once you've collected all of your data, what do you do to show it? So how do you visualize it or give it to people so that they can understand it? So I'll say, for instance, for BERT, we just completed a project with the Maryland Cannabis Commission, and that comprised of completing a report. We had to create ads and things like that to supply back to the state at the end of the project. But that's pretty much how we present the data. We collect it, and then I'm particularly decent at it, but I know how to visualize it and make it look like something people want to look at. So then I turn big, ugly reports into something that looks really, really pretty and colorful, and then I give it to you. So that's how we try to visualize data. In my mind, data is not the most beautiful thing to look at. So I try to turn it into something that's a little bit more digestible and easy to take in. So that means I'm going to put some colors, I'm going to do some graphs. So that's the best way that we as a team at BERT have decided to display data. But it may be different for your jurisdiction. Your jurisdiction may want a big report.
Like an infograph?
Yeah.
Okay. I mean, yeah. When we've reported out to our coalition, our evaluator has this fancy report, they do it. But when reporting to the state for the end year report, I've put charts in there. And we're working on a project with partner, and they're doing an infograph. We're doing an infograph about it. So I guess that's what we've done so far.
Thank you.
Mhm.
And I'm looking at some of the names in here. I know some of you have actually reached out to us on our TA forums to have me do them for you, which I'm very grateful for. So just a shameless plug, if you ever need assistance with that, our team is capable of doing that and creating things for you. So if you have kind of trouble with visualizing your data and you need a push or you need something, your TA form can assist with that.
Hi, I wanted to talk about that too. Are you able to help us? So, not so much visualize our data, but visualize, I'll just tell you what I want. We finally just have all this great new data from the Youth Risk Behavior Survey, and we want to do monthly infographics to our coalition that include like 2 of the data pieces, 2 action items that the coalition can do and then resources. Or is that something you're able to help us with as well?
Yep, I've done
Okay.
it for a few other jurisdictions. Yes,
Awesome. Thank you so much.
sure.
Oh, so you're able to take the the most recent YRBS data and help like for our jurisdiction, for different jurisdictions, analyze and okay.
Yeah, so I've had some jurisdictions that just wanted like maybe 2 or 3 social media posts. So I created those, or some wanted full-fledged infographics. We've done those. So definitely utilize the TA report form, because we're able to kind of look into it and see what you might need. Everyone doesn't have an in-house person that can do graphic design or data visualization. So if you don't, utilize your resource. I'm here to help you out. So just like that beautiful, colorful thing on the other slide, that was created just for Pride to kind of emphasize the importance of the work that is being done in substance use. So I can do that for you. I don't have a problem helping.
Okay, thanks.
All right, awesome. I'll go to the next question. So what lessons have you learned after completing your evaluations? So after you've finished your project and you've gone back around to evaluate how your prevention strategies worked, what have you kind of learned about after that?
I personally am working on something right now where readability is really important. And I didn't really consider that until afterwards. It's just super important to make sure that it's everybody, or especially your target audience, is able to understand the data that you're presenting.
Thank you. I think that's a great point. Sometimes we make reports that are a little bit above our audience, and we put in acronyms and things like that that they can't read, where we really need to kind of keep in mind health literacy. So thank you so much for bringing that point up. That's excellent. I can kind of give an example of some lessons that we learned after doing an evaluation. I'm currently working with a county that had a good amount of data on some fatal and non-fatal overdoses. And in that data, it had information about the location that they happened, the part of the county that happened, the age, and the substance of choice. And what we were able to do with that data is understand where we need to target outreach, what types of strategies we need to do, and the population or the age group that we need to work with. So we were able to look at that data and kind of shift how they are going about their prevention efforts just based on that. So just the evaluation from that made us understand that they maybe were not targeting the right population, or maybe their efforts were not in the right area. So they're going to shift where they do their prevention for the next fiscal year and kind of take a step back and simplify it a little bit. Have any of your jurisdictions kind of had to step back, or you kind of leave something where it is and kind of go back to the drawing board and try again? No? Okay, so y'all are all perfect. Okay, y'all have been doing this for a while, so you may be really well at it. Okay. And do any of you have any tips for others that are using to evaluate data? Do any of you have any additional tips for other people?
I mean, obviously have a good evaluator. So
Yes.
you work with someone, of course, and who's an expert and in guiding us in that process. So that's really important that you have an expert on board.
Does every jurisdiction usually have an evaluator? Is that common? Okay.
We have our evaluator, and I have to tell you guys, like, I just took over the supervisor role 5 months ago, so I'm still learning a lot. So we really are only using our evaluator to help us analyze the data and prepare the annual report. We spent because this is, thank God, a 2-year grant. So we spent the first year developing 4 comprehensive surveys that we're starting to administer 2 of them, and we'll administer the other 2. So like basically a survey for each strategy. So I guess my question is, like, those surveys are going to monitor the long-term change over time that our whole strategy is able to affect. But in terms of like the individual programs, so we're going to be able to measure different parenting practices and their effect on substance use over time. But do we also want to know if an individual parenting session helped people think or feel differently about that? And then, like, what do you guys think?
I guess it would be helpful to know initially, because then you may need to shift around a little bit. What does everybody else think?
Yeah, I agree. It's important to know what the community is going to respond to, you know, what they'll show up for, or, you know, how to get the message out, or how to, you know, do like a virtual training or whatever you're going to put in place. But yeah, what's more convenient. So I think a survey is a great idea to find that out.
Okay, thanks.
I've also found with doing surveys and things like that, they often require incentives to get people to continue to do it or come back. So I think that's a good way to figure out if the incentive itself is working, because maybe that $5 gift card to Chick-fil-A is not as important as $20 in groceries. So I think just a small, you know, analysis of, you know, what that incentive is still a good indicator of how successful a program is or isn't. And that's a small thing that we really don't think about all the time is the incentive enough to get people to keep coming? But sadly, that's kind of how the consumer's mind thinks or works.
Well, we're doing, our strategy too is a community-based process, SPIF process. And we're in the process of finalizing the documents for submission to the IRB. And we came up with, or our evaluator helped come up with like $25 gift card. I'm not sure which from where, whether it would be like from Amazon or something like that, but we didn't ask the community that question. So I don't know. Yeah, we might, I don't know how it'll go because we haven't.
I think it just depends on the population. So, you know, we do a lot of in-person now, thank goodness, since, you know, post-COVID, but we table a lot of different populations, college campuses, senior fairs, you know, that kind of thing. But I have to say, they all have in common, they love to get the free stuff. So the promotional stuff, especially if you have choices, you know, it's like, I never give out a free item unless they do the survey. So typically it doesn't even have to be a gift card.
Yeah, do you mean like swag, like
Yeah, any kind of swag, or make a swag bag filled with stuff, and you know, but I don't give it out unless they take the survey. So we either do like a QR code, or, you know, we have both versions if they want to do paper version. So, you know, it's more convenient, or we're having issues with the QR code, that's our backup. But yeah, that's I'll get like 100 surveys done. It's incredible how they fall right into that. So.
And then the data from your surveys, are you finding that you're receiving quality data, or are you getting people kind of just jotting anything down for the goodie?
You know, well, we certainly relate the data to the population. So like at the college, we're looking at, you know, alcohol, cannabis use. So it's something that they're being honest about. That's all we ask, you know, obviously it's anonymous. But yeah, we're getting good survey. And also with the seniors, like we'll ask them if they know where medication drop-off sites are, that kind of thing, how to dispose of medication safely. So yeah, and then they'll come back, well, you know, where do I dispose of it? So they're being honest about their answers, you know, and usually they're quicker surveys. You don't want to I try and avoid like the 40 question survey. If I do have gift cards as a backup, if, you know, for the longer surveys. So, but yeah, typically we get pretty honest data. I find when we do stuff online, we get people from all out of the area, you know, so it is better to do something in person like that.
Thank you. I think that's really helpful feedback, and that definitely ties into, you know, how you're using your data and what tips you're doing. So thank you for that. And I've seen some of your reports. You do have great success. So thank you. All right, I'm trying to see how much more time we have here. We have 5 more minutes here. Oh goodness. Okay. All right. Does anybody else have any additional tips they'd like to share with how they're using their evaluation data? So to say, it looks like we only have 4 minutes left, so I definitely don't want to sit here and bore you in silence for 4 minutes, but I don't mind quiet moments though, truly. Oh, okay.
I have a question. When we do fill out a form for requesting TA from BERT, is that for whoever's our TA for our region, or does it depend on what we're requesting the help on.
Correct. It depends on what you want for your help. So
Okay.
if you have a TA lead that's just getting data, then they're going to get it. But there's an option there that requests for data visualization. If you hit that, then it just comes right to me. And then what happens after that is pretty much we schedule a meeting. I talk with you to figure out what it's for, who's your audience, how much you want created, and when is your timeline. After that, I pretty much create it for you. And then we go back and forth with edits until you love it. And then that's it.
Okay, thank you.
Sure. Okay, awesome. Well, we have 3 more minutes left, but if you have any questions or if anybody wants to chime in, feel free. Thank you so much for those of you who participated in the chat. It's always intimidating to do these breakout sessions because everybody is just not willing to talk. And I think we all have Zoom fatigue, honestly. So thank you for those who participated in talking or even worked in the chat. I appreciate it.
Thanks for your tips too.
Sure, I'm happy I can help.
How do we get back to the main session? Will we do it automatically?
It'll do it automatically.
Okay.
You'll just pop back in. It'll do like a 30-second countdown towards it, and then you'll just pop back in. And then
Gotcha.
if you don't automatically go back in, I'll just throw you back into the main session.
Okay, thanks.
All right, looks like we're jumping back in. Thank y'all. Have a good one.
sorry if we didn't get enough time, but with your groups, do people want more time to go back, or are we good to share?
I think we're good to share. We always run out of time, but maybe it's just me.
Our group got through all the questions, so I think we are probably good to share.
All right, and definitely as we're going through, other people want to add tips or things that they can definitely raise their hands, we can hear, since we have time. So the first group, that how to collect evaluation data.
I guess that was me, right? They had me taking notes, y'all. You know, I'm good with narrating, but note taking is not my strong suit. So my group is gonna have to chime in. Let's see. Hold on, I gotta change my view. You have to forgive me. Okay, here we go. Okay, so I'm gonna, so what tips would you like to give others to help build their timeline? And I'm gonna be calling on James to share his example, because he gave a great example of what something he worked on and implemented in his jurisdiction. And actually, I'm calling a couple people from my group to talk. So James, where are you?
Sure.
Okay.
I can provide like the compiled note if you like, Dr. Tara. I already wrote all of that sort of stuff. So
Okay, hold on. I'm gonna let James go for a second.
Okay.
Okay, thanks.
So in Garrett County, what we did is I came into this in February, and the timeline that we had was all just one big, huge, long document. And so from the grant application, I took things by each. I kind of just sectioned it out a little bit differently, and I created my very own timeline in Google Sheets. And what I was able to do then is share that with every single person on our team so that they could have access to get in and see each individual thing. And in that timeline, I broke it out by action steps, persons who are responsible, the timeline that it needed done, and then the measure of success. And so not only could everybody see that all together, but then I could assign specific tasks to specific team members. And once they completed those tasks, then they're able to get in there and actually mark completed. And then we are able to track the timeline very closely. And not only is it done that way, but then every team member got a folder with the timeline as well that we bring to in-person meetings so that we can just make sure that we are on task. And we noticed that there was just one thing that we were never going to get to this year. And so that was one of those things that we went, okay, so this timeline was unrealistic. We're going to have to move that one thing and really just focus on it at the beginning of the next fiscal year. So using the Google Sheets really helped us to stay on task and to keep everything very organized, strictly cut from the grant application.
And similarly, Deborah and Carol really shared about, they really had wished that someone had shared with them, or they had a clearer picture. And then I'm going to ask Deborah to share for a minute about, you know, because their concepts sort of grew, they really sort of didn't have a grasp on how much time it was going to take them to really do a good job with data collection. They hadn't really wrapped their head around that data collection was going to take a little bit more time, and how much time they really needed to dedicate to true evaluation. So Deborah, would you mind just sharing just for a minute?
Sure, I'll be happy to do that. We started out initially thinking we wanted to conduct a survey to get some local information because we hadn't done one for a while, and started putting together our plan for that. And the question that we had was, what is something that you wish you had known in advance to help you prepare and manage an effective timeline? And so what happened with us is that one survey became 4 surveys. And we realized that there was a lot more that we really wanted to know and needed to know. And that really changed everything. And as a part of that process, then we needed to use the IRB process. And so sometimes thinking about what you need requires a little bit more time and a little bit more persistence in developing that concept before jumping in. And once we did, we were very excited about it, and we're excited to launch it, but it did take about a year. So that's kind of where we are now, and I'm happy that we did it, but knowing in advance really what you need and where you're going to go is really the first step before putting together that timeline. And that way we wouldn't have had to make so many adjustments, but I'm really glad that we did that.
And so Luisi did bring up the point that she thought it would be great if jurisdictions did share, or if there was a database where they could pull from to get survey questions and pull from that, so that they didn't have to, create from scratch their own surveys. And so we talked about that a little bit. And then James touched a little bit about the second question here about what steps do you do to ensure your team is aware of the timeline. And he talked about how he shares his timeline with his team in monthly meetings. He asked them to bring it to the meetings. Luisi actually shares the action steps with her team, with the deliverables themselves from her, the action steps from her evaluation plan, and she then goes over the deliverables and adds another column, and then talks to them about what steps, what barriers, what do they need to help support to actually get over what hasn't been completed and what they need to move on. And then the final question about what were some of the barriers. And I think that was kind of in unison. Everybody said staff shortages, participation, finances, approval, and then time. So that was our questions.
Thanks, Michelle.
Yeah.
Just a reminder to everyone, and Deborah kind of brought this up, that the planning of your evaluation, it does take time, but and that actually taking the time and really like thinking that through in the long run is really helpful in terms of like the quality of what you'll collect, and to make sure that you'll be collecting what you intended to actually gather, versus just trying to have a quick survey, and then if it's not really meeting the goals of what you need to really see if change or measure an impact for long-term, seeing how things are, either what's going on, and to then measure change based on your strategies. Deborah, you unmuted yourself, go ahead.
I just wanted to tell everyone how grateful we were for all of your help and your team's help, and that you were very patient with us and very encouraging. So a lot of those changes really came as a result of our conversations and how we could be more effective at getting the data we really wanted. So I appreciate that and all that you did with us.
Well, thank you.
Just chiming in to second that, you guys were so incredibly helpful, and we're going to have such incredible data because we took our time and got the technical support that we really needed, because we're not the experts in this. So thank you guys very much.
No problem. So that kind of does lead us into our next group, the planning evaluation of sort of either using existing tools or developing new ones. Just a side note to that, before I share what we discussed in our group, in terms of like what other jurisdictions have developed, or if other tools exist, that's always the first step, is seeing what already exists. And if you are not sure if there's if there's a similar survey that maybe has already been done, the first step should probably be to reach out to the BERT team And we can share with you examples of perhaps surveys that maybe other jurisdictions have implemented, or help lead you to, we can do some back research to help you out to see, for instance, whenever we develop a survey, our first step is a lit review and other to try and see what existing tools exist, which tools exist, and then go from there rather than we definitely don't want to start from scratch.
I also shared, Nicole, with the group that if they are implementing evidence-based programs, those programs usually have an evaluation tool, and within those evaluation tools will include surveys. Part of them being an evidence-based program, they have to have an evaluation tool. So that usually comes along with them having a survey already existing that they can use and utilize for their programs. So we can help them identify those, as well as we are also working on a database of survey questions that they can
Follow up to our one that we did way back when on alcohol only. So now it will be everything.
Yes, yes. So for the future.
But definitely drop us an email if you, we have a folder full of all the surveys that have been that we have from jurisdictions and that we've developed, that if you have a certain topic or an area that you want to have certain data indicators, definitely see if we might have actual questions that exist already. All right, so for planning, where do we find, so majority of our groups that they do use like existing surveys, or they've developed, or no, they've developed a lot on their own, but are constantly sort of reevaluating their evaluation tools to improve them. You know, developing their own, doing stuff for pre and post, a lot with if there is programmatic, you know, evidence-based programs, they're using the standard evaluation tools that do come with those. But for like bigger events or one-time programming where you have a lot of people trying to, you know, collect data after those to measure behavior change or just knowledge, coming up with ways to collect that, which kind of goes into the when to implement, but we sort of went back and forth, you know, what people use, and then when sort of kind of went back, overlapped in our discussion about in how they're actually using the tools. So stuff around incentives with bigger groups and catching them. We had two colleges in our group, so they were sharing. I don't know if Larissa or Emily wanted to give anything what they shared about sort of what they use, and it sort of ties into when to implement, but they gave some tips in that regard of planning and collecting.
I can jump in, Nicole. I think that Larissa and I both agree that, especially with the throng of students that can come through some of our larger events, that having an evaluation tool at the end of the program where we can incentivize them to complete it by giving them either a giveaway or here's your ticket for food or something of that nature, to collect it at the end where they're receiving something, because that's often what draws students to our programs. So at the end is really the best time.
And then Emily, would you be willing to share that evaluation board?
Yeah, I wish I had a visual of it on me. Our health educator created a large evaluation board. It's kind of like a large whiteboard that has a lot of, it's got a giant grid on it with options at the top that are color coordinated, so that we give a dry erase marker of a different color to students based on what they received, I guess, from the program. Like if they learned something, if it's something they didn't know before, if it changed their perspective on something, if it will influence their behavior, if the program met their needs. There's like 6 maybe different options on it. And so at the end of the program, they can choose the color that corresponds with their feedback on the program. and what they got from it. And so that's been something that we've been trying to use in the last year and a half, 2 years or so, to gauge effectiveness and learning from our large scale programs, because these are programs that have maybe 200 plus students coming through. So doing something like collecting pre-post data isn't going to work, but this seems to have an effect. And we're still evaluating it. Sometimes we question, like, did we get the data we wanted from this or not? So we're continuously reevaluating this.
And how do you then collect how does that data get recorded from the board?
So then we basically calculate it all into an Excel spreadsheet, and then track it from there.
Gotcha. Okay. If you have a picture, would you be willing to share that with the group?
I will see if I can dig one up on the spot. If I can't find it right now, Nicole, I'll send it to you later and you can disperse maybe.
Okay, that sounds great. Thank you.
Yep.
Were there any other tips? I think, one big tip that actually Larissa shared that I think is really a really good tip when planning is feedback on your tools. So she shared that they will, present the survey to students for feedback on, like, is this, what we should be asking? Is this, you always want to, get that feedback on your stakeholders. So are the questions clear? Do they know how to answer it? And then also that feedback loop of, like, always double checking, like, what were your main goals for this survey, and really going through and being like, are we asking questions that meet our objectives? And, are people that take this kind of being able to understand that? Lisa, did you want to add anything to this feedback of how you guys do that?
No, I think you have it covered. We have peer educators, so we really use those students that we have that work for us with the programmatic piece. So they let me know, like, no, Miss Reese, that's not going to work. That's too long. That's too many questions. So they're very candid with their responses to let me know if we're going to hit the mark or miss the mark with it. So I often filter a lot of stuff through them before we actually disperse it out or actually do things programmatically, because they tell me pretty honestly if it will work or not.
Great, that's a very helpful tip. Thank you for that. Anyone else that wasn't in our group that wanted to add to it, or anyone else from the whole group, any tips when it comes to finding existing tools or developing your own for evaluation? All right, if anyone thinks of anything, definitely drop it in the chat and I'll share it with the group. So we'll go next to the when best to implement, how to implement your evaluation. So Brooke, you were with that, and
yes,
Roland was supposed to be in that group. I don't know what happened there. So
he came, but
okay.
But then I don't know what happened, but it's okay. We worked through it. So in our group, we had Todd, who stepped up and said he would take the notes and be willing to share. So Todd is going to do that.
Awesome.
And I turn it over to Todd.
Thank you, Brooke, and thank you for facilitating our group discussion, and of course to our team, our group members, for providing their feedback. So I'm going to try and share this information correctly. So please, anyone from our group, if I get it wrong, please chime in and correct me. So when is the best time to implement? So Becky Meyer stated that as soon as possible, that once you have all of your ducks in a row, once you have your community buy-in, and while you have your momentum, just roll with it. That's the best time to implement. Joe, I think it was, with Frostburg, stated that, again, while you have your momentum going, especially with a revolving door of new students constantly cycling through, that's the best time for them to implement. When it came to which implementation strategy did you find the most interesting, or which one did you had you not done before that you want to try? Patrick stated that he really enjoyed doing the community-based process, simply because it helps to inform all the other strategies. So I wanted to ask Patrick and put Patrick on the spot here. Did you want to take a moment to speak more about that, Patrick?
Yes, sure, Todd. Hi, everyone. So one of the good things about the community-based process that it helped us to collect data on all the other strategies. So it serves other strategies and open the doors to like new ideas or new concepts or even like new strategies that we could implement in the future. Doing the community-based process, it allows us to focus on disseminating surveys, taking our times and conducting like focus groups, because I mean, we plan for almost a year that we need to finish, like, for example, like focus groups, key informant interviews and surveys. And it's not restricted on a specific strategy that we have to implement it and do all these data collections while implementing a specific strategy. So it serves as its own strategy. And at the same time, it helps us to collect data on all our strategies by including like questions during the surveys, collecting data from different population age groups in the community to help us gather all the data we need. So this was one of the good strategies that has been implemented with multiple counties.
All right. Thank you. Thank you, Patrick.
Sure. Thank you.
And that really, Patrick was the only one who really chimed in on this particular question. And I wanted to open it up to the other group members to see if they had any other thoughts before I move on.
Just Todd, I think that also this was really reflecting on what way to implement evaluation, like so different evaluation implementation strategies.
Okay.
So I don't know if so pre-post or just like a surveillance or so I don't know what people tend to use or haven't tried before when it comes to time points. And I think a lot of people do convenience samples. Have anyone thought about going to a different way to, you know, population level data, stuff like that?
All right. So I'll open up to the group. Does anyone have any other feedback based on Nicole's comment?
I think I'll say that was my fault because we did talk about strategies, but I'll go back to reiterating kind of what Patrick said, which was, it was many of the comments I think that we heard was about what to use, and figuring out what to use, probably the timing of when to do things and how to get people to actually respond. If I misquoted that, let me know, but I that's what I was getting from what everybody was saying. But going back to what Patrick said, I think that just the ability, it felt like using the community-based process strategy feels like it actually gives you the space to do this, to again collect this information, because it's deliberate. You have to, that's your strategy to implement, that you kind of have to do these things. And it helps to do that, collect that information to inform what it is that you're going to be doing moving forward, and inform the other strategies. I would go to the tips.
Yeah. Go ahead, Todd. Sorry.
Okay, so what tips would you give someone when they are beginning to implement their evaluation strategies? I think the first one and the biggest one was incentives, be it gift cards, gas cards, food, gift certificates, to help assist with the data collection process, helping to get folks to attend focus groups. The other comment that I heard that to me sounded like a very good idea is, having a relationship with, as much as you can, with the folks that you're collecting data from. I think it was Sadie that mentioned that having a relationship with the pharmacists in the southern end of the county helped with their data collection process and response rates. Whereas they're having a little bit more of a struggle on the other side of the county, the northern end of the county. I believe that was correct. Sadie, did that sound accurate?
Yes, that did. You did great explaining that.
Wonderful. Thank you. And then if we want to talk about what barriers have you noticed when trying to implement your evaluation? We had one member mention that a sample size, getting the appropriate sample size was a barrier, be it, group or community level data collection sample size. That seemed to be a barrier. Also accessing raw data from other agencies was difficult. They'd like to see an efficient process by which to gather or share get data from other agencies. Charlene mentioned that coming up with the correct data collection tool to collect the data was a barrier. And then Sadie also mentioned getting folks to respond to the surveys was, I guess goes back to response rates, and getting people to respond to their surveys was a barrier. And I think that was all for us. Did I miss anything?
I think you captured it well. Thank you, Todd.
Yeah, thank you, Brooke. Thank you, Todd. All right, so if anyone has any other questions or tips, but like if you weren't in that group and you have a tip, please share it in the chat and I'll read it, because other people might have tips for any of these different collection, planning, and implementation. And now, while we move on to the last step with your evaluation of how to use that data that we've collected. So we'll let Paris, your group.
Thank you. So I did not designate a note taker. So group, if I forget anything or if I misspeak, please do not hesitate to unmute yourself and say that. So our group really talked about, what we do or how they present data. And the main point was it just depends on who needs to see it. So they mentioned working on a lot of health literacy and kind of visualizing it better so that they can disseminate the data to who needs to see it. So sometimes it's a report, sometimes it's a social media post, sometimes it's an infographic, but it really depends on who needs to see the data to determine how it's being used. And for the lessons they learned, most of them involved them updating and understanding health literacy and identifying what they learned from the data. So pretty much what exactly the data told them and how they needed to shift their program or update their deliverables based on what the data showed them. And some of the tips that were given were to one, utilize the TA request form, because we can help you out with data visualization and helping you to understand where to use your data. And some of the other tips were that they thought it was important to do some benchmarking in between your steps. So not necessarily waiting till the end of a project to use the data, but looking in between the project and stopping and making adjustments where needed to evaluate what's happening at the time, as opposed to waiting to the end. So I think it was slide maybe 3 or 4 where you mentioned starting from the end and moving up. A lot of them mentioned that that's a good tip to take to kind of stop and reverse and kind of change it up.
Great. How many people share their results with sort of the community or your other stakeholders to sort of promote? I feel like how many people with like a show of hands feel you do a good job sort of promoting your success? And I feel like, realizing that it's not just, a checkbox to collect data, but then using that data and sort of disseminate it to kind of show the community and others what you're doing and how well it's impacted. And Sadie, go ahead.
We share this information that we collect with our coalitions. We have 2 different, and I share it in other meetings as well, but we have 2 coalitions, the Drug Free Communities Coalition and the Stand Together Garrett County Against Drugs Consortium. And we always share our data, whether it be the poundage for the Dropbox locations or the evaluation pieces that we have with our pharmacies.
Okay. Anyone else have any questions when it comes to anything we shared today, for developing tools, implementing them, utilizing it, measuring how well things are going, as well as anything. Well, Health Disparities will touch base with you guys with that, but any questions on anything evaluation and how it can be, we can help you with that. All right.
That just means that everybody's got it together and we're going to see some excellent evaluation results and tools and all that other stuff. They don't need us anymore. They're going to do it perfect.
Hey now, wait a minute, Brooke. Nobody's perfect. We always need TA from you guys, always.
I just have a lot of confidence in our Maryland folks.
Well, Brooke, I think what happens is as we go along through the process, the questions start coming up. Right now, it's all in the mind. We're thinking about stuff, but when we start really getting things done, it's like, oh, I need to get TA. I need some help. So we're not saying that we know everything. We're just trying to get it all deciphered in our minds. That's all.
I'm messing with you all, but see, y'all got advocates there. Sadie and Pat came out, was like, don't do that to us, but we hear you. Thank you all.
I want to say Vanessa's been helpful for our county with our IRB process and is, we're still in the process of receiving TA from her. And I do like using your request form and I will be reaching out for more help. So thank you.
Thank you.
Thank you.
Just one last push that, with the data, like you guys all said, getting numbers is important. So the more you guys can help us with promoting MPOS, it helps everybody, but also you at your individual county level, the more you collect, then we can actually have enough to share those results with you, broken down by all the different age groups if possible. Brooke, go ahead.
Speaking of pushes, we're here talking, the folks are participating here, receive our block grant and our OMPP, but on the OFR side, we have an evaluation. So we need you. If you all participate in OFR on the teams, are managing the teams, whatever the case may be, please, please, please work with the OFR coordinator and get your team members to fill out the evaluation survey that Bert pulled together. We really need that information to evaluate what we are doing and how we are implementing our programs so that we can, figure out which direction we need to go. So same thing, push, 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 push. We appreciate it. That's it.
For the last MPOS, Jackie, I was going to type it, but I'll just say it. For the last MPOS of 2021, we did not share individual county numbers. We did a state level report. That's what Paris shared the little image of. We can share that report. I believe it's on our website, but I don't know if we actually disseminated it as to let you guys know. The issue was we had to cut a lot of the responses. So our overall numbers were pretty low because we had a lot of bots on that round of survey. And so it just was not enough. There was not enough to really be able to give you jurisdiction level numbers. We were able to do it at the state, so you can at least see what that looked like at the state level. And we put all the measures in place, and we're just hoping that this time we won't have that issue, and fingers crossed. It's just, it's a mess out there with these anonymous survey links and these crazy bots. And of course, when you guys are saying what's the best way to get people to take a survey as an incentive, one of the ways that you can sort of eliminate it is like not mention incentives on your advertising, but then that also then eliminate people, regular people that want to take the survey. So, you know, that's what the risk we're taking, but we'll see. Hopefully we won't have, we'll get enough real data to counter the bad numbers. But everyone should have gotten MISA at least for this last year, so. Brooke, if you want, well, yeah, we sent out, do you want me to drop the link for the OFR survey? Also,
Absolutely, sure.
let me quickly do that for you guys. Great, there you go. So that's the OFR survey for people who either in OFR or make sure you know all your other OFR team members and want to encourage them to take that survey. And we'll end a little early, so this was great. And if everyone has any questions, yeah, definitely reach out. Don't forget about the TA request form if you need help developing surveys, identifying existing evaluation tools to help you with your evaluation, any evaluation planning. We are here to assist you on those areas. Oh, Lynn, real quick, yeah. Mhm.
Sorry, did Helene say that that you guys were going to talk more about this health disparity statement at the end of the meeting?
I did a few slides at just giving you kind of like what it is when we talked about, and so the exact what is going into that you guys will receive the guidance, and then we'll have a full webinar on sort of like what that is. We just wanted to slightly to give you a brief background on health disparities and what that will be coming.
Okay, thank you.
Mhm. All right, so if you guys have any other questions, just reach out. When you leave, you'll see the evaluation survey will pop up on your screen. So we hope that you can respond, and have a great rest of your day and week.
Did everybody sign in the chat?
At the beginning, yeah.